looking at a product is the label. You want to make sure it's labeled so you know exactly what is in there. You want to make sure that it's free from solvents, free from pesticides, free from mold. So there should be lab test results on the label. And the regulations require that, but right now we're still kind of in the in-between period, so you might see products that don't have that quite yet until until next year when everything kind of moves over. But lab testing, making sure there's no solvents, pesticides, anything in there that you don't want, but also lab testing to confirm the amounts of CBD and the amounts of THC. And there's going to be a CBD to THC ratio, and so you're going to want to know what that ratio is, and then you're also going to want to know the total milligrams, probably milligrams per ml if it's a dropper, or just you want to know the ratio as well as the total so that you know what you're getting. So the most important thing is knowing what you're getting in your product so that you know the exact dose, the exact terpenes if you can. The more you know about the product that you're using and how it affects you, the better you'll be able to then pick out another product. So the more things on the label, the better. So there are a lot of products that will confirm the percent of THC and CBD, and they'll list the different terpenes. And it's basically the more information, the better on the label. And I wanted to focus a little bit on pain and inflammation, specifically when I talked about dosing, because there's just so many different disease states that we use and so many different doses. But for pain, I would say if I had to choose a typical dose for CBD, I would say 10 to 40 milligrams. But the thing about dosing, the most important thing is that it's always personalized. So there's no one dosing for everybody. Somebody might feel great microdosing and only taking 1.5 milligrams. Somebody else may need 100. And so you really have to kind of look at your own history and start at a low dose and go slow. And then that dose response curve that we saw with the mice, that can kind of happen with CBD, where you reach a point and it's just not as effective anymore, or maybe even less effective. So what we find is that you don't always want to go up on the dose. Sometimes if you're not getting additional benefit, you actually want to back down on the dose, and then the person will respond better. So it's very, very, very individualized. This is not a kind of thing where you can just take one pill and everybody gets the same dose and you'll know if it worked or not the next day. This is something that could potentially take you weeks or even months to find your optimal dose and to find which delivery system is going to work for you, because there's so many different products on the market and so many varying doses. And basically, if a product is considered high CBD, then it has more than 4% CBD. And just to compare that to THC, high THC product would be maybe 20% or so. So 4 is kind of a low number, but that's high in terms of CBD. There's just different amounts of these cannabinoids in the plants. And that's pretty much all that I have. I just wanted to see what questions you guys have, and then I can kind of maybe focus more on certain things based on what your interests are. So does anybody have any questions?
Got a quick one. I have to apologize, I have to jump out, but for maybe it's not quite clear. Anxiety and stress, and I guess very connected to that, but potentially a different dosage like sleep. What would you recommend as far as like what type of ratio or products and things like that?
Yeah, so for sleep, you would have to see, again, the indicas tend to be more sedating, but also the terpenes. So myrcene would be one terpene that kind of is good for relaxing muscles, relaxing you in general. Let's see, linalool. Not sure if I'm spelling that right. That one is a terpene that has kind of a lavender scent to it, and that one is great for anxiety. You probably want to avoid anything with too high THC. THC can cause anxiety for people, but the CBD will mitigate that. And so basically the THC works directly on the receptor. The CBD doesn't work directly on the receptors, but it regulates things, and the CBD and the THC work together so that the CBD brings down the psychoactive effects of the THC. It prolongs it, but it makes it more tolerable. So if you get too high, the CBD will bring down the high and just make it kind of more sustained, less intense.
And then kind of building on the anxiety, stress. So if I suffer from migraines, I've heard, I haven't tried it yet, that oftentimes for pain, the THC helps, but that it can also make things more intense. So for like headaches and things like that, people have said that it could be kind of hit or miss. What are your...
There are a lot of strains that work for migraines. I think it's just very patient specific. So again, it's kind of a trial and error thing, but yeah, the THC definitely usually does help for pain. It just depends how sensitive you are to the effects of it. And so different ratios commonly used would be 20-1, 4-1, and 1-1. And for most things, because we have this synergy, this whole plant synergy that we really want a little bit of THC most of the time. We don't really want no THC. So 20-1 is what I would start with if you think that you're sensitive to the THC. And most people don't really feel anxious or high at all with that dose. So the 4-1, that one you could potentially feel the high from, but the 20-1, most people do not. And again, I would start just really low dose.
Great. All right, I'm going to jump out, but thank you.
Yeah.
Questions? Do you guys have specific conditions that maybe to ask about?
I have a question about, let's see, I guess I have a few questions, but would you start with, I guess if you were using it for pain, like maybe headaches or something, I guess, or even like maybe fibromyalgia might be something, would you start with something, because I am a naturopathic doctor and I just have a hard time knowing what to start with, because it seems like the dose, like there are different ratios and there are different dosages and there are different forms, so like, is there kind of a good way, like I guess it just depends on the type of pain, but
yeah.
Would you normally start with 20-1 and see how they do with like a couple different dosages and then move up to 4-1?
Yeah, a big piece too is the patient's comfort level with THC. So some people just don't want the high, they are scared of it, and we don't want to give anybody a bad experience. We want to make sure we're starting low enough, going slow enough that they're not going to have a bad experience. Other people don't mind the high. So usually if it's somebody that isn't sure how they feel about the high, I would start with 20-1. And then if they're not seeing benefit from it, or if they feel like they have to use a ton of it to get benefit, then they might want to try the 4-1 and see if that works better for their condition. And then it would kind of depend on the condition and just
it
what.
seems like you kind of have to know. I'm interested about the terpenes too. I didn't know that was like one of the biggest.
Yeah, that's I think that's the way it's going, is we're going to get away from the sativa indica and more toward the terpenes, because the sativa and indica, the plants look a little different, there's subtle differences, but it's really just kind of stereotyping. They don't always fit into those categories. And so the terpenes give you kind of a better picture of what effects you're going to get from the plant. And then,
Sorry,
go ahead.
can you recommend any resources to like link terpenes to specific things you're trying to address?
Project CBD is a really, really good website about CBD in general, and they talk about terpenes on their website. I don't know of any specifically for terpenes, but I'm sure they're out there. Leafly is a website, and they have an app where you can look up strains, and it'll tell you kind of what the effects are, and they might list out the different terpenes and different strains as well.